Hello students, I welcome you all to Obstetrics and Gynecology with Mackler. So in this module, we'll be dealing about cone biopsy, right? So in the previous module, while we are discussing about the gynecological procedures concerning about the cervix, we discussed about the pap smear, which is a screening test followed by colposcopy, and we dealt with the endocervical curettage. In this module, we'll be dealing about the cone biopsy. So let's start discussing about this topic. So before starting with the topic, what do you mean by cone biopsy? So biopsy is nothing but removal of any tissue from the body for any diagnostic purposes. So biopsy can be taken from any part of the body where there is going to be any suspicion of malignancy, right? So from that particular organ, we are going to remove some amount of tissue and send it for histopathological examination. So this is the biopsy. Okay, so now here we discuss about the cone biopsy. So what do you mean by cone biopsy? So it tells me that the name itself tells me that I'm going to remove tissue from a part, and the tissue is going to be in a shape which is similar to a cone. So therefore it is called as a cone biopsy. So this cone biopsy is also termed as conization. It is also termed as conization. Is that clear? Okay. So this procedure is actually both diagnostic as well as therapeutic. So it has the advantage of both diagnostic and therapeutic advantages. Is that clear? Okay, so initially let's discuss about the diagnostic advantages before discussing about the therapeutic advantages. Is that clear? Okay. So this is basically a procedure which is going to remove the tissue from the cervix, and this tissue is going to be in cone shaped manner. So cone shaped tissue samples are removed from this cervix. So this cone shape is actually going to include which sample of the cervix? It is going to include the tissue sample from both the ectocervix or the exocervix and the endocervix and the transformation zone, which is the area between the new and the old squamo-columnar junction. So this cone shaped tissue is actually removed from endocervix, ectocervix and the transformation zone. So this cone is going to include all the three important parts of the cervix. So from all these three parts of the cervix, the biopsy is going to be taken. So you are going to remove the tissue and you're going to subject it for histopathological examination. So this can be done with the help of a scalpel or with a wire loop as well. So when you do with a scalpel or a wire loop, you're going to remove a cone shaped sample, and this sample is going to involve the ectocervix sample from the ecto, endo and the transformation zone. So from this itself, it tells me that since it is going to involve the tissue from exocervix, endocervix and transformation zone, therefore it will help me in diagnosing any invasive cancer, right? If the cancer is going to be invasive, it is going to involve all the quadrants of the cervix. So it tells me if there is any invasive cancer or not. So that is going to be one diagnostic indication of doing this cone biopsy. So this sample is going to involve, as we discussed, the ecto or the exocervix, the endocervix and the transformation zone, which is TZ. Is that clear? Okay. So now you tell me, what is the diagnostic indications of doing this cone biopsy? It is because, like we discussed in the previous module, I told you that while we do the endocervical curettage, the report will come as adenocarcinoma in situ. So what is adenocarcinoma in situ? Adenocarcinoma in situ means it is not an invasive cancer. The cancer is restricted to one particular quadrant, that it has not become invasive. So we all know that the most common type of cervical cancer to arise from the endocervix is adenocarcinoma. So if the report of endocervical curettage is going to be adenocarcinoma in situ, then I told you in the last module that after the report comes as adenocarcinoma in situ, in order to rule out the invasive cancer, whether the cancer has spread beyond the endocervix, it has involved the transformation zone, the ectocervix and so, you have to do this cone biopsy, since it involves the samples from all the three important parts of the cervix, that is the ecto, endo and the transformation zone. Is that clear? So as an algorithm, once the report comes as adenocarcinoma in situ, you have to follow up it with the cone biopsy to rule out any invasive cancer being present. And then if there is any suspicion of adenocarcinoma in situ, in those cases also you have to perform this cone biopsy. And if in case the report of the pap smear comes as high-grade squamous intraepithelial lesion, if the report comes as high-grade squamous intraepithelial lesion, what is going to be the next step? Since it is a high-grade squamous intraepithelial lesion, you have to proceed with the cone biopsy or the conization. Is that clear? Always HSIL corresponds to CIN 2 and 3 of the colposcopy report. So since it is corresponding to CIN 2 and 3, you have to follow up with cone biopsy or conization. So in pap smears, if the report comes as HSIL, since it is a screening test, you can't plan any treatment based on the screening test report. So you have to follow up it with cone biopsy or conization. Is that clear? Okay. And then if the transformation zone is not entirely visible and you can see some lesion that is extending inside the cervix, that is, it is extending into the endocervical canal, in that cases you can actually do two things. One thing is that you can perform this endocervical curettage, and following this endocervical curettage you definitely have to do cone biopsy in order to rule out any invasive cancer. So for that reason, if the transformation zone is not entirely visible, that is transformation zone type 3, and the lesion is extending into the cervix, you can do cone biopsy as the next step. Is that clear? Cone biopsy. And to rule out any invasive cancer being present in the cervix, you have to take this approach of cone biopsy, because cone biopsy involves the samples from the ecto, endo and the transformation zone. So basically the indication goes like adenocarcinoma in situ. What are you going to do if the report of the endocervical curettage comes out to be adenocarcinoma in situ? You have to do cone biopsy in order to rule out any invasive cancer being present in the cervix. And in any suspicious case of adenocarcinoma in situ, you have to do cone biopsy. If the report of the pap smear, which is a screening test, comes out to be HSIL, that is high-grade squamous intraepithelial lesion, you have to follow up it with cone biopsy or conization. And if the transformation zone is type 3 and you can see some lesion that is extending inside the endocervical canal, you have to follow up it with cone biopsy or conization. And in order to rule out any invasive cancer in the cervix, you have to do cone biopsy or conization. Is that clear? So these are all the diagnostic indications of cone biopsy or conization. Is that clear? Okay. So now we're going to discuss about what is the therapeutic indication. The one such therapeutic indication of this cone biopsy or conization is that it is done as a treatment. But it is done as a treatment in young patients. So young patients with cancer cervix, and if it is going to be stage 1A1. So stage 1A1. So when we discuss about the cancer cervix, we'll be discussing about the staging. But as of now, you have to remember one thing with respect to the cone biopsy. That is stage 1A1. So stage 1A1 is actually a micro-invasive cancer. Okay, it is a micro-invasive cancer where the cancer is limited only to the cervix. Okay, the cancer is limited only to the cervix. And the micro-invasiveness is less than 3 millimeter. So, less than 3 millimeter invasive. So, if the invasion is less than 3 millimeter micro-invasive stage 1A1 in young female patients, you can do this cone biopsy or conization. But the same stage of stage 1A1 in a elderly patient, are you going to do this cone biopsy? No, because there are chances that this patient might end up in invasive cancer in the future, right? So for that reason, you're going to do hysterectomy in that patient, right? Type 1 hysterectomy. What is type 1 hysterectomy? You're going to remove the uterus and the cervix. Right? Is that clear? Stage 1A1 in young patients, you do cone biopsy or conization. But in elderly patients, you have to do hysterectomy, that is uterus and the cervix. Why in young patients you are going to do this cone biopsy or conization is that because young patients, she might not have completed her family, right? So for that reason, you're going to do cone biopsy as of now. And then you ask the female, after doing this procedure of cone biopsy, you ask the female, go complete your family as early as possible and come back to me. Just test for the invasive cancer in the patient being present, and you have to do hysterectomy sooner or later. See, for the purpose of completion of family, you're going to ask the patient to come after completing the family as early as possible, since the probability of this cancer becoming invasive is more. Is that clear? But in elderly patients, there is no need to do any cone biopsy or conization, right? You have to proceed with the treatment of hysterectomy, type 1 hysterectomy, where you're going to remove the uterus and the cervix. Is that clear? Okay, so treatment of stage 1A1 of cancer cervix in young patient is cone biopsy or conization. So it is actually micro-invasive, that is, it is less than 3 millimeter in depth. So less than 3 millimeter in depth, stage 1A1, the treatment is conization. Okay, so we have discussed about the pros of this cone biopsy. Now, what is the cons of the cone biopsy? The disadvantage is that this is actually an OT procedure. So this procedure has to be done in the operation theatre, right? This procedure has to be done in the operation theatre, and anesthesia is definitely needed. Why? Because is that since you're going to remove a cone specimen of tissue from the ecto, endo and the transmission zone, the patient is going to have much pain. So for that reason, and for proper relaxation of the muscles, you have to give anesthesia, and therefore after the procedure the patient has to be with us for around 24 hours, right? So admission is also needed for the patient. So it is not cost effective also, right? Because actually the procedure is only a 15 minutes procedure, but the patient requires OT, anesthesia and admission, so therefore it is not so much cost effective, right? Okay, so since it is a 15 minutes procedure also, for certain indications you are going to do only it under OT, under anesthesia, and admission is of course required, right? Yes. And then the most important cons is that this can lead to the problem of cervical insufficiency. So what is the cervical insufficiency? So when we are going to discuss about the obstetrics, I'm going to tell you a term called as cervical incompetence. That is nothing but when the there is a theory that when the diameter of the cervix increases, the length of the cervix is going to decrease. Is that clear? This is the diameter and this is the length. So as the diameter of the cervix is going to increase, as the cervix is going to get dilated, right, the length of the cervix is going to get shortened. So if the length of the cervix is less than around 2.5 centimeter, it is suspicious of cervical insufficiency. If it is going to be less than 2 centimeter, it is diagnostic of cervical incompetence. Is that clear? Length of the cervix less than 2.5 centimeter, it is suspicious of cervical insufficiency. Less than 2 centimeter, it is diagnostic of cervical incompetence. So why? Because is that you are going to remove a conical shaped tissue piece, right? A conical shaped tissue from the cervix, and this tissue is going to involve the ecto, the endo and the transformation zone. Since you are going to remove a tissue piece from the cervix itself, it is going to result in cervical insufficiency. So because of the cervical insufficiency, the patient can have labor in the preterm period. Term is when between 37 to 41 completed weeks, but any labor which occurs at less than 37 weeks, it is going to be called as preterm labor, right? So around 28 to 36 weeks is preterm, right? So any labor which occurs at less than 37 weeks is actually preterm labor. So because of the cervical insufficiency and cervical incompetence, the cervix is going to dilate much earlier before the term period, and the female is going to expel the fetus. So cervical insufficiency, which is going to result in preterm labor. Is that clear? So one of the most important cons of this cone biopsy is cervical insufficiency. Since we are going to remove the cone piece of tissue from the cervix, it is going to result in cervical incompetence, which causes preterm labor. Is that clear? Okay, so always in any female who is pregnant, if she is going to come to you and value measure the in ultrasound value measure the cervical length, if it is going to be decreased, you have to ask the female whether she had any history of conization in the past. So if she had a history of conization in the past, then definitely it is the actual reason for the cervical incompetence. Is that clear? Yes. Okay. And then after the procedure, for about 24 to 48 hours, the patient is going to have severe muscle and abdominal cramps. Right? Severe muscle and abdominal cramps is going to be experienced by the patient. And then you have to avoid vaginal tampons, douching, cleaning, and coitus for around 6 to 8 weeks after the procedure. So around for 6 to 8 weeks after the procedure, you have to avoid any coitus and any vaginal douching, placement of any tampons, and the menstrual cups. You have to avoid for around a period of 6 to 8 weeks. And for 24 to 48 hours, the patient is going to experience muscle cramps as well. So for that reason, after the completion of procedure, the patient has to be with us for at least 24 hours, and then you can discharge the patient. So this is all about the cone biopsy, which has both the diagnostic as well as the therapeutic indication. So please remember, the only therapeutic indication is that a cone biopsy is done in young patients with stage 1A1. It's very easy, 1A1. That is the therapeutic indication. Diagnostic indication in order to rule out any invasive cancer. Is that clear? So this is all about the cone biopsy. As you can see here, a cone-shaped piece of tissue is removed from the cervix. Right? This is the cone-shaped piece of cervix. So this is all about the cone biopsy. I hope I was very fruitful about discussing about this topic, right? I made very simple. After discussing so much with myself, I'm taking this topic to you after so much of efforts. I hope I made this topic very simple and clear for you. But in spite of discussing this, you have any doubts, please write to us in the Mackler handle. We will write to us early as been possible. Is that clear? Okay, so let's meet in the next module with another interesting topic.